Today we have incredible excitement about immunotherapy. And obviously immunotherapy can be viewed in different ways. The present drugs that are addressing PD-1, PD-L1, CTLA-4 are the latest in immunotherapy. We should not forget that immunotherapy is something we've been doing already in the past. When we address the HER2 receptor with trastuzumab, it's not only trastuzumab with chemo, it's also trastuzumab itself that elicits a mechanism called ADCC, which is immunotherapy. But coming to the present day immunotherapy, it is true that most patients, when they have experienced chemo or immunotherapy, will say immunotherapy is easier. So you would say that elderly patient will also say the same. Well, we have to define who is this elderly person, because some elderly patients are extremely fit and they can be treated in the same way as younger patients. Other elderly patients have comorbidities which might decrease their physiological reserve. And if they hit one of the side effects that immunotherapy does have, they might not be able to tolerate it as well as as a younger patient. So that's the whole question, is how can we define who is the elderly who is fit and is unfit? And for this we have guidance. If you look at the studies, the problem of the studies is that while patients above the age of 65, if we accept this as a limit of elderly, we now tend to say that above 75 should be the limit, represent often a minority of the patients in the studies, because studies have all kinds of inclusion-exclusion criteria. So we cannot say that those elderly are representative of the overall patient population above a certain age, number one. And number two, there is a slight increase indeed of some toxicities for these patients, but then we have to look at the benefit. And many say that elderly patients have lesser immune responsiveness. Again, it's not true. It depends who this elderly person is. And actually some people say that the elderly, because often they have inflammatory diseases, are prepped to respond to immunotherapy, and this might increase maybe also the efficacy and toxicity. And others say, well, no, the elderly are not responding that well. It is true for also younger patients who are unfit. So overall, the message today, with the limited data we have available of immunotherapy in the elderly, says, yes, it can be done. Yes, they do respond, but be careful. Some of the toxicities, and a simple example is diarrhea, which is present with some immunotherapies quite frequently. It's easier to control for a younger patient. For an older patient that has some difficulties moving from the chair to the bathroom, it can be a real problem.